I want you to stop whatever you are doing right now and think about the last time you drank a glass of water. When was it? How much did you drink? What time of day was it? Was it cold or room temperature? Did you drink it all at once or sip it slowly? I'm asking these questions because after 65, every single one of those details matters in ways that most people, and honestly, most doctors, have never explained to you. And getting even one of them wrong could be silently damaging your kidneys, your heart, your brain, and your blood pressure every single day. Water is the most fundamental substance your body depends on. You already know that. But here's what you do not know. After 65, the way your body processes water changes so dramatically that the drinking habits that were perfectly fine at 40 become genuinely harmful at 70. The timing changes, the quantity per sitting changes, the temperature matters, and the type of water you are drinking could be doing things inside your body that would genuinely shock you. I have been practicing internal medicine and geriatric care for over 22 years, and dehydration, along with its equally dangerous counterpart, improper hydration, is one of the most consistent and most preventable contributors to the health problems I see in my senior patients every single week: kidney decline, blood pressure instability, brain fog, morning fatigue, urinary tract infections, dangerous medication interactions. All of these conditions are directly connected to how seniors are drinking water, not whether they are drinking water, how. In this video, I am going to reveal the 5 most common water drinking mistakes that seniors over 65 make every single day. I will explain exactly what each mistake does inside your aging body, and I will give you the precise research backed protocol for drinking water correctly after 65 are the timing, the quantity, the temperature, and the type, so that every glass of water you drink from this point forward is actively protecting your health rather than quietly undermining it. Stay with me until the end because mistake number 3 is the one that genuinely shocks my patients the most. It involves something that millions of seniors do every single morning with the absolute best intentions for their health, and it is creating a dangerous imbalance inside their bodies that their doctors are almost never checking for. Before we begin, tell me in the comments, how many glasses of water do you drink per day? And do you drink it cold, room temperature, or warm? Type your answer below. I want to know, because by the end of this video, your answer may completely change. Before I reveal the mistakes, I need to give you the biological context, because understanding what changes in your body after 65 is what makes these mistakes make sense. And once you understand the biology, the correct behaviors become obvious rather than arbitrary. Change 1: the thirst mechanism fails. In younger adults, thirst is a reliable signal. When your body needs water, you feel thirsty. You drink, the system works. After 65, this system breaks down in a very specific and very dangerous way. The hypothalamus, or the region of your brain responsible for detecting dehydration and triggering the thirst sensation, becomes significantly less sensitive with age. Its osmoreceptors, the cells that detect changes in blood concentration, lose responsiveness. The result is that by the time you feel thirsty after 65, you are already meaningfully dehydrated. Not slightly, meaningfully. A study published in the Journal of Physiology found that adults over 65 showed a 40% reduction in thirst sensitivity compared to young adults, meaning they felt no thirst at mild to moderate dehydration levels that would have caused strong thirst signals in a 30-year-old. This is clinically significant because it means that drinking water only when you feel thirsty, which is the natural and instinctive approach most people use, is genuinely inadequate after 65. You cannot rely on your thirst to tell you when to drink. You must drink on a schedule. Change 2: kidney filtration. Efficiency declines. Your kidneys are responsible for regulating the water and electrolyte balance in your body. They filter your blood approximately 40 times per day, removing excess water, waste products, and maintaining the precise concentration balance your cells need to function. After 65, kidney filtration efficiency, measured by what clinicians call the glomerular filtration rate, declines by approximately 1% per year. By age 75, most adults are operating with kidneys functioning at 60 to 70% of their peak capacity. This decline has two critical implications for water intake. First, your kidneys are less able to concentrate urine efficiently, meaning they waste more water in urine production, making seniors more vulnerable to dehydration even at the same fluid intake as when they were younger. Second, your kidneys are less able to excrete excess water rapidly, meaning that drinking too much water too quickly creates a dangerous dilution of blood electrolytes, particularly sodium, that younger kidneys would handle easily, but aging kidneys cannot. Change three, total body water decreases. At age 30, approximately 60% of your body weight is water. By age 75, that percentage drops to approximately 50% in men and 45% in women. This reduction is primarily due to the loss of muscle mass, which holds significantly more water than fat tissue. What this means practically is that seniors have a smaller water reservoir, less buffer against dehydration, while simultaneously having a less reliable thirst mechanism to detect when that reservoir is running low. This combination makes seniors dramatically more vulnerable to dehydration than younger adults, even under identical conditions. A study from the National Institute on Aging found that clinical dehydration, defined as greater than 2% loss of body water, occurred at 3 times the rate in adults over 65 compared to adults under 40 under the same environmental conditions and activity levels. Now, let me walk you through the 5 specific mistakes. Pay close attention because I guarantee that at least 2 or 3 of these describe exactly what you are currently doing. Mistake one, drinking too much water too quickly. Most people assume that more water is always better, and they act on this assumption by drinking large quantities at once, a full 500 milliliters bottle all at once, 2 or 3 large glasses in rapid succession, or forcing down a large amount in the morning to get their daily hydration done early. After 65, this is dangerous. Here is why. When you drink a large volume of water rapidly, it dilutes the sodium concentration in your blood, a condition called hyponatremia. In younger adults with efficient kidneys, this dilution is corrected quickly. The kidneys excrete the excess water within minutes, and sodium levels normalize. In adults over 65 with declining kidney function, this correction is much slower. The diluted sodium state persists longer, and sodium, often called the master electrolyte, is critically involved in nerve signaling, muscle contraction, including your heart muscle, and brain function. Symptoms of even mild hyponatremia include nausea, headache, confusion, fatigue, and muscle weakness. In severe cases, which are far more common in older adults than most people realize, hyponatremia causes falls, seizures, loss of consciousness, and can be life threatening. A study published in the American Journal of Medicine found that hyponatremia was present in approximately 7% of community dwelling adults over $65, and that the most common contributing factor was excessive water intake in too short a time period. The correct approach, which I will detail in the protocol section, is to distribute your water intake across the entire day in smaller, more frequent amounts, sipping rather than gulping, consistent rather than occasional large volumes. Mistake two, drinking cold water on an empty stomach. This is perhaps the most controversial mistake on this list because it goes against what feels natural, particularly in warm weather. But the evidence for its impact on senior health is meaningful and worth understanding. When you drink very cold water, particularly first thing in the morning on an empty stomach, several things happen in your digestive and cardiovascular system that are more impactful after 65 than at younger ages. First, cold water causes rapid constriction of blood vessels in your stomach and esophagus. This vasoconstriction slows digestion, can trigger cramping, and in seniors with any cardiovascular vulnerability, creates a sudden demand on the heart to maintain temperature homeostasis. Second, cold water consumed on an empty stomach triggers a vagal response in some older adults, a reflex activation of the parasympathetic nervous system that can cause a brief drop in heart rate and blood pressure. In seniors with autonomic nervous system decline, which, as I discussed in a previous video, is extremely common after 70, this vagal response can cause dizziness, lightheadedness, or even fainting. Third, cold water solidifies any fats present in your digestive tract, slowing their digestion and creating additional digestive burden in a system whose efficiency is already declining. Traditional medicine systems, Ayurvedic, traditional Chinese medicine, and Japanese Kampo, have long recommended warm or room temperature water for older adults, and modern research is beginning to provide biological explanations for why this recommendation has persisted for thousands of years. A study from the Journal of Neurogastroenterology and Motility found that warm water consumption improved gastrointestinal motility by 20% in adults over 65 compared to cold water, directly reducing constipation, bloating, and digestive discomfort that are extraordinarily common complaints in older adults. The recommendation, particularly for morning hydration on an empty stomach, is room temperature or warm water. Reserve cold water for hot weather activity when its cooling effect is genuinely beneficial. Mistake three, drinking large amounts of water with medications. This is the mistake I mentioned at the beginning, the one that genuinely shocks most of my patients, and it involves something millions of seniors do every single morning with completely good intentions. Many seniors take multiple medications in the morning, and because they have been told that staying hydrated is important, and because they want to make sure their medications are properly swallowed and absorbed, they drink a large glass or even two glasses of water with their morning medications. For certain medications, this is absolutely correct behavior. Some drugs require adequate water for safe absorption and to protect the kidneys from concentration related damage. But for other medications that are extremely common in senior populations, large water intake at the time of dosing actively interferes with the medication's effectiveness or creates dangerous interactions. The most significant example is levothyroxine, the thyroid medication taken by millions of older adults for hypothyroidism. Levothyroxine must be taken on an empty stomach and absorbed through the gut lining before food or significant fluid intake. Large water consumption with levothyroxine significantly dilutes its concentration in the stomach and reduces absorption by up to 40%, meaning that seniors who take their thyroid medication with a large glass of water may be getting only 60% of their prescribed dose without knowing it. And inadequately treated hypothyroidism causes fatigue, cognitive decline, weight gain, depression, and cardiovascular risk. Similarly, certain blood pressure medications, bisphosphonates for osteoporosis, which require specific water volumes and position requirements, and diuretics all have specific hydration interactions that most patients are never fully counseled on. The action here is not to stop drinking water with medications. It is to speak with your pharmacist, not just your doctor, about the specific hydration requirements for each medication you take. Pharmacists are specifically trained in these interactions and can give you precise guidance on which medications require more water, which require less, and which have specific timing requirements relative to fluid intake. Mistake four, ignoring hydration during winter. This is a mistake that is driven entirely by sensation, and it is extremely common in seniors. In summer, you sweat. You feel hot, you feel thirsty. Drinking water feels natural and necessary. Most seniors hydrate reasonably well in warm weather. In winter, you do not sweat noticeably. You feel cool or comfortable. You do not feel thirsty. And so many seniors dramatically reduce their water intake during the winter months, sometimes by 30 to 40% DARS, without realizing it. But here's the reality. In winter, you are losing water constantly through a mechanism most people never consider: respiratory water loss. Every breath you exhale in cold weather carries water vapor. In cold, dry winter air, your respiratory system loses significant water with every single breath throughout the entire day and night. And indoor heating systems dramatically reduce humidity, accelerating this loss further. Combined with the already blunted thirst mechanism of aging, winter dehydration in seniors is an extremely common and clinically significant problem. It contributes to increased UTI rates, kidney stone formation, constipation, worsened arthritis symptoms, cognitive decline, and falls, and all of which are more prevalent in seniors during winter months. The solution is to maintain your hydration schedule regardless of season and regardless of thirst. The number on your schedule does not change because the weather changes. Mistake five, relying only on water for hydration. This final mistake is less about what seniors are doing wrong and more about what they are missing, an important distinction that significantly affects their ability to maintain optimal hydration. Plain water hydrates your body, yes, but optimal cellular hydration, the kind that actually reaches your cells rather than just passing through your kidneys, Depends on electrolytes, specifically sodium, potassium, and magnesium, which act as carriers that pull water into cells and tissues. When you drink plain water without adequate electrolytes, particularly if you are drinking significant quantities, you can paradoxically find yourself urinating frequently, feeling thirsty despite drinking, and experiencing symptoms of dehydration despite adequate water intake. The water is not being retained by your cells because the electrolyte carriers are insufficient. This is particularly significant for seniors on low sodium diets for blood pressure management, a very common prescription. These seniors are often restricting their sodium intake, drinking adequate plain water, and still experiencing cellular dehydration because the sodium needed to carry water into cells is insufficient. The solution is not to abandon sodium restriction. That recommendation exists for important cardiovascular reasons. The solution is to include naturally electrolyte rich foods in your daily diet: coconut water, bananas, sweet potatoes, avocados, and low sodium broths that provide the potassium and magnesium needed for cellular hydration without significantly raising sodium levels. Now, let me give you the precise research backed hydration protocol that I recommend to all of my senior patients. This is not generic advice. This is specifically calibrated for the physiological reality of aging bodies over 65. How much? The standard 8 glasses per day recommendation was developed for average adults and does not account for the specific needs of seniors over 65. The current evidence based recommendation for healthy adults over 65 is 1.5 to 2 liters of total fluid per day, approximately 6 to 8 moderate glasses, not 8 large glasses, moderate glasses of approximately 200 to 250 milliliters. This should be adjusted upward in hot weather, during illness, after exercise, or if you take diuretic medications, and it should be discussed with your physician if you have heart failure or kidney disease, conditions that require specific fluid restriction protocols. When, this is where the protocol differs most significantly from general advice. Distribute your fluid intake evenly across the day in small, frequent amounts rather than large amounts at specific times. Upon waking, 1 moderate glass of room temperature water before anything else. This replaces the fluid lost overnight through breathing and mild perspiration and begins the process of raising blood pressure gently before you stand. Mid morning, 1 glass between breakfast and lunch. With lunch, 1 moderate glass with your meal. Drinking moderate amounts with meals actually aids digestion and medication absorption for most seniors. Mid afternoon, 1 glass. This is the most commonly skipped hydration moment and the one that most directly contributes to afternoon fatigue and early evening cognitive decline in seniors. With dinner, 1 moderate glass. Early evening, 1 final glass no later than 2 hours before your intended bedtime. Hydrating too close to bedtime increases nighttime urination, which fragments sleep, a critical concern given the sleep issues I discussed in a previous video. Temperature, room temperature or warm water as your default, particularly for morning hydration and medication taking. Cold water, acceptable during exercise or in hot weather when its cooling function is genuinely beneficial. Type, filtered tap water is appropriate for most seniors. If you live in an area with high mineral content in tap water, a simple carbon filter removes most contaminants while preserving beneficial minerals. Distilled water, which has had all minerals removed, is not recommended as a primary water source for seniors because it lacks the minerals that support electrolyte balance. Mineral water can be beneficial for seniors with adequate kidney function. The magnesium and calcium content supports bone health and electrolyte balance. Avoid sparkling water as your primary source. The carbonation can worsen acid reflux, which is more common after 65, and the pressure can cause bloating and digestive discomfort. Here is your complete action plan, simple, specific, and starting today. Action step 1: starting today, stop drinking water based on thirst. Set 6 reminders on your phone: morning, mid morning, lunch, mid afternoon, dinner, and early evening. Drink 1 moderate glass at each reminder, regardless of whether you feel thirsty. Action step 2: switch your morning glass to room temperature water. If you currently drink cold water first thing in the morning, simply fill your glass the night before and leave it on your bedside table. By morning, it will be room temperature. Action step 3: this week, bring your complete medication list to your pharmacist and ask specifically about the water requirements for each medication. Ask which should be taken with more water, which with less, and which have specific timing requirements relative to food and fluids. Action step 4, add one electrolyte rich food to your daily diet. Half a banana with breakfast, a small sweet potato with lunch, a glass of diluted coconut water in the afternoon. These small additions dramatically improve cellular hydration without requiring any additional supplements. Action step 5, set your final water of the day no later than 2 hours before bed and stick to it consistently. Better nighttime sleep combined with better daytime hydration creates a genuinely transformative combination for senior health. Action step 6, share this video with every senior in your life because right now they are drinking water the same way they have always drunk it, completely unaware that the habits that were fine at 40 are creating real health risks at 70. Water is life. That is not a metaphor, it is biology. Every cellular process in your body, every thought, every heartbeat, every immune response, every joint movement depends on adequate, correctly timed, appropriately consumed hydration. After 65, water does not become less important. It becomes more important and more specific. The difference between getting it right and getting it wrong is measurable in your kidney function, your brain clarity, your blood pressure stability, your joint comfort, and your energy throughout the day. You have been drinking water your entire life, but after 65, it is worth taking a few minutes to make sure you are doing it in the way that your body actually needs. If this video gave you genuinely useful information, if it changed even one water drinking habit starting today, please subscribe to this channel. Every single week, I bring you this kind of specific, senior focused, evidence based health information, the kind that fills the gap between rushed medical appointments and the detailed knowledge you deserve about your own aging body. Hit the like button if this video surprised you. Leave a comment below. Which of these 5 mistakes were you making? I want to know. And your comment might be exactly what another senior needs to read today. Thank you for watching. Drink well, drink wisely. Your body depends on it every single day.